It is the middle of the night. The house is quiet and dark. You reach into your baby's crib to check on them, and you feel it. Your little one's skin is hot to the touch. A wave of panic might wash over you. What does this mean? What should you do next? Every parent has been there, feeling that jolt of worry when their baby feels warm. It's a universal experience that can make even the most confident parent feel a little lost. The first step is to take a deep breath and remember that you are not alone in this. Knowing what to do begins with understanding what you are dealing with. So, what exactly counts as a fever in a baby? It is not just about them feeling warm. To know for sure, you need to take their temperature with a reliable digital thermometer. For babies, the most accurate reading comes from a rectal temperature. A true fever is generally considered a rectal temperature of 100.4 degrees Fahrenheit, or 38 degrees Celsius, or higher. Temperatures taken under the arm or on the forehead can be less accurate, but they can give you a general idea. Having a good thermometer and knowing how to use it is a key part of your parenting toolkit. It is also important to understand that a fever itself is not an illness. Instead, it is a sign that your baby's body is fighting something off. Think of it as their internal defense system turning up the heat to combat germs like viruses or bacteria. This is a normal and healthy response from the immune system. The number on the thermometer is just one piece of the puzzle. How your baby is acting is often a much more important clue to their overall well-being. A baby with a slight fever who is still playful and drinking fluids is very different from a baby who is lethargic and refusing to eat. Therefore, your first job is not to panic, but to gather information. Take your baby's temperature accurately. Observe their behavior closely. Are they still smiling at you? Are they interested in their favorite toy? Are they making wet diapers? These observations will be incredibly helpful when you decide on your next steps. By staying calm and methodical, you can shift from a place of fear to a place of empowered action. You are your baby's best advocate, and having clear information is the first step in providing the best care possible for your little one. Once you have confirmed your baby has a fever, your mind might jump to the worst-case scenarios. But most of the time, the cause is something quite common and manageable. Many mild fevers are simply the body's way of dealing with everyday challenges. For instance, a common cold is a frequent cause of a low-grade fever. Your baby might have a runny nose, a little cough, and feel a bit warmer than usual as their body works to get better. This is a sign that their immune system is doing exactly what it is supposed to do, building strength and resilience for the future. Another very common reason for a mild fever in infants is teething. As those tiny teeth push their way through the gums, it can cause discomfort, irritability, and sometimes a slight rise in temperature. While teething does not typically cause a high fever, a temperature just over 100 degrees Fahrenheit is not unusual. You might also notice your baby is drooling more, chewing on their hands, or has swollen gums. This is a normal developmental stage, and the associated fever is usually short-lived and not a cause for major concern. It's a rite of passage for both baby and parent. Vaccinations are another classic trigger for a temporary fever. It is very normal for a baby to develop a low-grade fever within a day or two after receiving their routine immunizations. This is a positive sign that the vaccine is working. It is prompting your baby's immune system to build up protective antibodies against serious diseases. Your pediatrician's office will usually give you information about this potential side effect after your baby's shots. The fever is typically mild, lasts only a day or two, and responds well to simple comfort measures at home. Lastly, sometimes a baby can get a little overheated from their environment. Being bundled in too many layers of clothing or blankets, especially in a warm room, can cause their body temperature to rise. This is sometimes called environmental hyperthermia. Before you worry, check the situation. Are they dressed too warmly for the temperature? If you remove a layer of clothing and their temperature returns to normal within a short time, you have likely found the simple cause. This is a good reminder to dress your baby appropriately for the season and the indoor temperature. While most fevers are not dangerous, there are certain signs that should tell you to seek medical help right away. These are the red flags that every parent needs to know. One of the most critical warning signs is extreme lethargy or unresponsiveness. If your baby is unusually floppy, difficult to wake up, or does not seem to recognize you, this is an emergency. A fussy baby is one thing, But a baby who is listless and barely reacting to you needs immediate medical attention. This could indicate a more serious infection that requires urgent care. Another major red flag is any sign of difficulty breathing. Listen to your baby's chest. Are they breathing much faster than usual? Can you see the skin sucking in between their ribs or at their neck with each breath? Do you hear a wheezing or grunting sound? Any of these symptoms, with or without a fever, are reasons to call your doctor or go to the emergency room immediately. Breathing issues should never be ignored, as they can become serious very quickly. Your baby needs clear airways to get enough oxygen, and any struggle is a sign something is wrong. Pay close attention to your baby's skin as well. A rash that appears along with a fever can sometimes be a warning sign. While many rashes are harmless, one to watch for is a rash that looks like tiny pinpricks or bruises under the skin that do not fade or turn white when you press on them. This type of rash, known as petechiae, can be a sign of a serious bacterial infection and requires immediate medical evaluation. Also, look for signs of dehydration. A dry mouth, no tears when crying, and significantly fewer wet diapers, less than 3 or 4 in 24 hours, are all red flags. Finally, a seizure is a clear sign to get help right away. Some young children can have seizures triggered by a rapid spike in fever, known as febrile seizures. While often frightening to witness, they are usually harmless in the long run. However, any seizure, especially a baby's first one, must be evaluated by a medical professional to rule out other more serious causes. If your baby has a seizure, place them on their side on a safe surface, away from any hard objects, and call for emergency medical assistance. When you have determined that your baby's fever does not come with any red flag symptoms, your focus can shift to keeping them comfortable. The goal is not always to eliminate the fever completely, but to help your baby feel better while their body does its work. One of the simplest and most effective things you can do is to make sure they are dressed lightly. Overbundling can trap heat and make the fever worse. Dress your baby in a single, lightweight layer of clothing and use only a light blanket if needed. This allows their body to release heat naturally. Hydration is absolutely essential when your baby has a fever. Fevers can cause fluid loss, so it is important to offer breast milk or formula more frequently. Your baby may not have a big appetite, but small, frequent feedings can help prevent dehydration. If your baby is over 6 months old, you can also offer small sips of water in between feedings. Watch for those wet diapers. They are your best indicator that your little one is getting enough fluids. A well-hydrated baby is better equipped to fight off whatever is causing the fever. If your baby seems very uncomfortable or fussy, you can consider giving them a fever-reducing medication. For babies over 2 or 3 months old, acetaminophen, like Tylenol, is an option. For babies over 6 months old, you can also use ibuprofen, like Advil or Motrin. It is critical to always check with your pediatrician for the correct dosage, which is based on your baby's weight, not their age. Never give a baby aspirin, as it has been linked to a rare but serious condition called Reyes syndrome. Medication is not always necessary, but it can help your child rest more comfortably. A lukewarm sponge bath can also provide some relief. Do not use cold water, rubbing alcohol, or ice, as these can cause shivering, which can actually make their core body temperature go up. Instead, use a sponge or washcloth dipped in lukewarm water and gently wipe their skin. This can be soothing and help bring their temperature down slightly. The most important thing you can offer is comfort. Extra cuddles, a quiet environment, and your reassuring presence can make a world of difference to a baby who is not feeling well. Knowing when to call the doctor can feel like the hardest part of dealing with a fever. However, there are clear guidelines that can help you make the right decision. The most important rule applies to our youngest babies. If your baby is under 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit or higher, you must call your pediatrician or go to the emergency room right away. Newborns have immature immune systems and can get very sick very quickly. A fever in a baby this young is considered a medical emergency until a doctor proves otherwise. Do not wait. For older babies between 3 and 6 months old, you should call the doctor if their fever reaches 102 degrees or higher. You should also call if a lower fever lasts for more than a day or is accompanied by other worrying symptoms, like unusual irritability or poor feeding. For babies older than 6 months, the number on the thermometer becomes less important than their behavior. A high fever of 103 or 104 degrees in an older baby who is still playful and drinking fluids may not be as concerning. However, you should still call the doctor if the fever lasts for more than 2 or 3 days. Beyond these specific age and temperature guidelines, it is time to call the doctor whenever your baby shows any of the red flag symptoms we discussed earlier. These include difficulty breathing, signs of dehydration, a concerning rash, extreme lethargy, or a seizure. You should also call if your baby seems to be getting worse instead of better, or if they have a fever after being in a very hot place like an overheated car. Your pediatrician is your partner in your child's health, and they expect these calls. They would much rather you call and it be nothing than have you wait at home and worry. Ultimately, you are the expert on your own child. You know their normal moods, behaviors, and cries better than anyone. If your parental intuition, that little voice in your head, is telling you that something is wrong, listen to it. Do not ever feel silly or like you are overreacting for calling your doctor or seeking medical care. Trusting your gut is one of the most powerful tools you have as a parent. When in doubt, always make the call. It is the safest and most reassuring thing you can do for both your baby and your own peace of mind. If you like this video, don't forget to like, subscribe, and share our channel Parents Journey. Drop your thoughts in the comments below.